Okay, Assalamu alaikum. This is a case where we have in our postgraduate clinic, and it's an overdenture. We have agreed on overdenture, but we were discussing the treatment plan in the beginning. Okay, can you come here, please? Okay, so this is an upper overdenture. It's not. It's unusual, by the way. صح? An upper. Most overdentures are lower. Okay.
Yes.
Will this affect our management or not? We're going to discuss it today. But we went into the small discussion about the types of overdentures. Definitely, this is a dental overdenture, so it's over teeth. So we're talking about what are the classifications? How do I classify this? What are the types of? To orient us with the writing. What are the types? You said what?
حكينا coping ولا coping.
Coping versus none. What else?
Splinted, non-splinted.
Splinted versus none.
Intracoronal, extracoronal.
Okay, none. Extracoronal,
أو long و short.
coronal versus intracoronal. What else?
الهايت حكينا.
Height,
Material.
in terms of height. Okay, what else? Material. Originally, it was all metal, okay? But because we have zirconia now, and you can put it in ultra-thin preparations, so you can use zirconia. What else? So this is material. What else? As a classification. Shape, dome versus. What are the shapes?
اللي هم الدوم shaped والثمبل.
Okay, okay. Then, what else?
Really magnet attachment with the
Attachments. Types of attachments. Okay. Other than splinted, non-splinted. Splinted, non-splinted is a type. A splint is a way of attaching, but these are movable. Okay, attachments. What else? Other types. With endo, without endo. Endo versus none, as well. Okay, so all of these are types. How am I going to choose? This is the treatment plan you have to do. This is the exercise I want you to do. The idea is each one of them needs, how do they differ? They differ one. What are the dental treatments before? Dental treatments before execution, okay? Second, what is the effect of the vertical dimension? Because some of them need a lot of vertical dimension, some of them need less vertical dimension. Also, the amount of retention that I want to gain. Each one gives me a different type of retention. So this is also going to go into our treatment plan. What else? Material. What are material I'm going to ask the technician to do? What are specialties that I'm going to work with or collaborate with, like for endo? Okay, so it's part of the dental treatment, but I mean there is endo, another specialty as well. What else can we think about? Space, اللي هو vertical dimension. Patient. 6. Medical status, yes, medical. Financial. Okay, financial. Distribution of what?
Teeth.
Okay, distribution of teeth. This is a question mark. Which teeth are we allowed to do overdentures on? Usually we need them bilaterally.
Well separated.
Okay, well separated definitely, but I mean I need them bilateral equal. So if I'm going to use a canine, usually we use another canine. If I'm using canine premolars, then it should be. I tried to do cross arch stabilization. I could not do an overdenture on one side. Okay, so the issue of cross arch stabilization, because if I'm going to use a single side, there will be a fulcrum point. That fulcrum point will lead to fractures. Okay, what else can I think about?
Condition of the tooth.
Condition of the tooth, the prior condition of the tooth. Okay, pre-existing condition of the tooth. Okay,
condition of the ridge.
The ridge itself. Does it need augmentation? Is it large? Do I need to substitute a lot? It also aids into the vertical dimension. This goes with the vertical dimension, by the way. Periostatus, yes. This is very, very important. Perio, because I need to maintain. This is a treatment that needs maintenance, high maintenance. So we're going to talk about the patient medical issue, or even the comprehension of the patient, the dexterity of the patient. All of these go here, because I need the patient to maintain this. This is a treatment that needs maintenance for the denture itself. It needs enforcements of the denture itself. I'm going to do a mesh in the denture. It needs maintenance of the parts, especially if they're mobile parts. you might need to replace, and the patient need to protect the dentures from fracture and so on. So so all of these go into my decision. So you work with your patient. Now you have the big picture. How do you do treatment planning as a prosthodontist? You have all of the options, and these are the same options available for anybody, not only a prosthodontist. Where does a prosthodontist become excellent, or where does it distinguished when he works on treatment options? For each option, he has limitations. He knows exactly, and any other than a prosthodontist might not have all of the limitations. They will also know that the prognosis. Okay, you know how to maintain it. Okay, so maintenance is an issue for a prosthodontist, and they can choose and pick. They have a lot of tools. Okay, this is where you as a prosthodontist work. So wherever I'm doing a treatment plan with you, these are the things I want an answer for. Not these. These are available for any dentist to do. Okay, it's your choice. How did you reach this choice within these limitations? Okay, choice of material, lab abilities, and so on. I begin. So this is where you as a prosthodontist work. I'll always have this. What is the limitation of this treatment? The prognosis and the maintenance needed. Okay, thank you.